Okay, go back to inbox again. Go to, what is this? Yeah, send it right there. That's where I can't get it open at, with the notes and stuff.
Oh, you should send it to me and there'll be possible another PowerPoint.
Should take a picture of this. Take a
Okay.
picture of that so you can send me.
If I'm sorry,
Take a picture with our presentation name.
Oh, thank you. And, oh, we're talking from right here, so that's cool. Thank you kindly. Can you, excuse me, can you show me how this works?
Yeah, green is forward and red is backwards.
Oh, that's so simple. Green is forward and red is backwards.
Perfect.
Okay.
Here you go, ma'am. That was fun, huh, Miss Patricia?
You're gonna educate me on how to do the clicker, huh?
That was awesome.
Do
right?
the first slide, do I leave this when I talk there?
Yes.
Sure.
Yes, ma'am. Yeah, we start in about 1 to 2 minutes. Thank you so much for being here. We'll get started here in a few moments.
Clearly we can't see nobody. Clearly we can't see nobody. Somebody take a picture of us sitting here too.
Okay.
So, do you have the notes?
That's what she's trying to help me get together.
Okay. Ready?
No, you don't have to see it. We need to, we're trying to get the notes together.
my computer just died.
Isn't there a way to download it, PT?
Yeah, this is
Oh my gosh, there's somebody just laughing smart. It's probably like a self-care tool for me if I could just hear somebody snort.
okay. I think once this loads, we're gonna have.
Okay.
There we go. Okay.
Thank you. Yes, feeling
Are
wonderful.
you ready to get started?
Yes. Felisa, would you like the notes?
I got
You have your own. You got
Okay, and then
Yes.
I will have you guys get started.
Okay, thank you.
Okay.
And we can just move it.
Good evening. Hello and welcome to our session, Best Practices and Tools for Adult Vaccination. We are so excited that you're here so we can share with you some of the strategies that we've learned over the past year about adult vaccination, especially around COVID-19. So I want you guys to stand up if you are a CHW. Stand up for me, please. And I want you to remain standing if you have gave instructions or done work around COVID-19 in the past couple of years. Thank you very much. We applaud your efforts in helping us slow down the spread of COVID-19. Thank you.
Thank you.
Hello, my name is Patricia Wilson. I'm a proud CHW from Milwaukee, Wisconsin. I am a member and a graduate of Milwaukee AHAG in 2017, a member of Wisconsin CHW Network, where in 2022 I received the award Bridging the Gap, a social justice award, and in 2021 I received the Advocacy Award. I work for Wisconsin Health Literacy as a Southeast Region Outreach Specialist, where I supervise 18 agencies and assist them in teaching vaccine educations. One of my agencies that I worked with, Mason Temple, they designed a digital binder. That binder was used to reproduce for the toolkit today, and we'll show you more about it. I am a co-chair, the new member co-chair of Wisconsin Public Health Association, the only CHW chaired committee that is non-CHW emphasis.
Wow.
So we are taking over different organizations and leading it forward.
Yes.
I am the Feeding America Food Leaders Lab Ambassador, where I help Wisconsin to slow down and end food insecurity, and I work on 7 women health committees.
So my name is Harita Harper, and I am from Atlanta, Georgia. And yay! And I have been working in the community for 15 plus years, in the community and in the clinic, so I've seen both sides. I currently work at Morehouse School of Medicine in family medicine in what is called the Innovation Learning Lab. So we don't have a box. We just do what's needed to get done for the community.
Ooh, nice to meet you, ladies. So glad to be working with y'all, you know. Hi, my name is NACHW Brown, and I am a community health and education worker / facilitator for El Sol Neighborhood Educational Center. But first and foremost, I'm a very, very successful teenage mother of 4 grown daughters. Yeah. My oldest daughter is 31. She's given me 4 grandchildren that I love tremendously. My second daughter is 27. She is in grad school in London, doing grad school, you all. My 24-year-old daughter brought home 3 associate's degrees. That's the one that likes to stay in her room and turn my air conditioner up to 62, you know. And then I have a 22-year-old that's just fabulous, and she's working her way into independence and cognitive thinking, and she's doing wonderful working. So I take pride in being a teenage mother because I have a story to tell. I have a common ground to share with people. So yes, I work out of San Bernardino, California for El Sol Neighborhood Educational Center in the training center. So I've been facilitating for a short 6 months, but I have learned a lot. So I'm so glad to be here with you all, and I look forward to sharing this information with you.
And also we have Ms. Felicia Miller, who is honorary member, but she could not be with us today.
Now that we've introduced ourselves, I want to give you a brief overview of today's presentation. We're going to talk about NACHW and their COVID-19 response, and how the Astro Adult Immunization Initiative brought us all together. We're going to share some experiences and what we've learned throughout this project, share with you a tool that you can take back to your community. NACHW is going to get that body moving with the CHW anthem, and then we're going to wrap it up with some questions and answers.
Sounds good.
Perfect. So now we're going to talk a little bit about NACHW. And we're just going to spend a few minutes on that. But first, I want to go over what is a CHW. And, you know, CHWs have existed in all human communities in nature, helping people since probably the beginning. So I have a favorite story that I always like to share about CHWs. And this one's gonna go back pretty far also. So 50 years ago, during the Cultural Revolutionary in China, some 1.5 million farmers, community workers received intense 3 to 6 month training in anatomy, bacteriology, birth control, maternal and infant care, and other topics, and were dispatched to provide basic health care for their rural communities. So even in the midst of the revolution, social upheaval, which kind of sound like where we might be today, this low-tech medical corps, named for the fact that many worked in their own rice paddy fields when they weren't tending to their neighbors. This was a highly successful and significantly reduced the infectious diseases, and it also boosted life expectancy. Hence the term that we now use, barefoot doctors. This program was a low-cost strategy that achieved high health outcomes. Its core principles was to keep people healthy, and the program actually reached everybody. It was universal health care. And just as impressive as the barefoot doctors were, they were part of the community. They understood the community, and they cared about the community, and they were trusted by the community, just like the people that we see here today. Well, in the 1980s, with market reform, the barefoot doctor system came to an end. But the program served as a model and inspiration, and it's a model that we continue to use today. So this group that we represent, you guys that are here today, this community, formed the National Association of Community Health Workers. And we were founded in April of 2019 after several years of planning and organizing by community health workers and allies across the United States. The vision, community health workers united nationally to support communities in achieving health equity and social justice. So again, the vision was grand and still is. And we engaged, we educated, we expanded, we established, we enhanced. We're leaders. We present opportunity. We recognize. We are supporters. We are partners. We are influencers. We're stakeholders. And so now we have a national voice, and we're trying to also find that national sustainability also. So nationally, we united to support communities in achieving health, equity, and social justice.
Absolutely. I'm so thankful for that story. I love, love, love to hear the story about the barefoot doctors, right? Barefoot, going to the homes, taking blood pressure, doing those kinds of things. It really outlines the role that we have today. All right, so moving right along. Let's see. Okay, so thank you, Ms. Harita. The COVID-19 pandemic highlighted several challenges currently facing the United States. But if we think about some of these challenges that we're facing currently, you can identify them with before and during COVID as well. So public health worker shortages, right? Public health worker, including doctors, nurses. So before pandemic, it was still kind of hard to get a doctor's appointment, right? Maybe you had to wait about a week or so. But then when you get in there with the doctor, he only giving you 12 to 15 minutes to talk about maybe one health issue. Is that right? So after pandemic, they come up with different ways that you can engage or get to your doctor's appointment, whether it was online or just calling in for the nurse for some advice. But it takes even longer to get into a doctor's appointment, right? And they have about 4,000 patients to one doctor. So also weakness and pandemic and other emergency readiness. Do you think we were ready for March 17th, 2020? We weren't ready for that. It was almost like we had the rug snatched out from under our feet, right? We all had something in common in the way that we were all shocked tremendously. And so that lack of investment in the right areas like transportation, food banks, those resources that could have really helped families that first couple months were not there. Existing racial and health disparities. You guys remember that after pandemic, that whole Black Lives Matter movement came about, right? It seemed like it was even worse. And so I remember working as a school-based community health and education worker, key component education. So a lot of times as community health workers, we work in a trifold contract or grant. So I was working with Institute for Community Partnership, Loma Linda Hospital, as well as El Sol Neighborhood Educational Center and the San Bernardino Unified School District. So with that, on March 17th, we were called to a meeting, and I was like, oh no, what is this meeting gonna be about? But we were informed that while everyone else was gonna go inside and quarantine, that we became the essential workers, right, in the community, and that we were not able to isolate, but we were deployed out to help, right? And we all said, yes, I'm going, I wanna help. So we went out delivering those food boxes to the homes, right? We went out delivering those technology laptop devices, those hotspots to the children who now had to do their homework and enter classrooms online, right? I remember a story that touches me really close to my heart is that there was a family that I was working with. She called me, she said, Mrs. Brown, I have six people in my family and 3 of them are sick with COVID now. How am I gonna isolate them in a 2-bedroom apartment? How am I gonna do that? So I said, let me think about it. Let me get back with you. So I called my coworkers, I said, hey, help me with this. We actually drew out a map of her apartment and created a map in a way that she could isolate her family to where that she could use that one bathroom and try to keep her family safe. Unfortunately, it might have worked for a little while, but it didn't work for, forever. So she called me, she says, Mrs. Brown, we're all sick. I can't get to the store for food. We have no food. And I said, oh, well, we want to make sure that you have some food. Some of my children have food allergies and they can't eat what's in the food box. Okay, I understand. So when we listen to the community, we're able to know more about how we can help them. So with that human connection, I was like, you know what, how about this? I come up with an idea. You can put that food stamp in a bag. and put your grocery list in a bag and hang it from that tree right outside. I'm gonna come by, I'm gonna get that bag, I'm gonna go get your groceries, and I'm gonna bring them back. She said, you really gonna do that for me? I said, I'm your community health and education worker. I'm your advocate. I'm here for you. And it made her feel so good, right? So I go, I get the food, I bring the food back, and I put it on the porch like DoorDash and Instacart. And she comes out to get the food, you all, and she's just crying and waving. Crying and waving. And then the kids come out, they crying and waving. Thank you, Mrs. Brown. And don't you know, I cried too. So, yes, we had a hyper focus on care coordination, and with that, we really used our core roles and our competencies. So that brings me to the Community Health Worker Core Consensus Project. It's primarily aimed to expand cohesion in the field and contribute to the visibility and the greater understanding of the full potential of us, community health workers, right? You can find out more about the C3 team in the toolkit, which we will introduce to you shortly, and how C3 project team look to hear from us, not quantitative data, but qualitative data, right? So not the numbers of people who they wanted to interact with, but the quality of the key informant meeting, the quality of that focus group, you know, the quality of those councils that came together and brought those life stories, those field stories that really outline what our 10 roles and 11, 10 roles and 11 skills would be. So, you all see ahead of you there, the Biden administration, it implemented 4 provisions pertaining to COVID-19. The National Strategy for COVID Response and Pandemic Preparedness, it really signaled the nation was moving out of crisis mode, right? Although for us, a lot of us are still shocked in a certain way. A lot of us still don't like to be in the room with a lot of people. A lot of us still don't like to be touched. We still want the mask on, we're still very aware, of our surroundings in that way. The COVID-19 Health Equity Task Force, Office of Minority Health established an executive order to identify and eliminate the health and social disparities. How about the American Rescue Plan? It laid out a roadmap to help us fight the virus, reopen those schools, which took a lot of organization to reopen those schools, a lot of tugging on parents to allow the children to go back, and to get the economy moving again. So strategies to address our national mental health crisis, thank goodness, because like I said, we were all affected by that shocking news. And so the strategy to address our national mental health crisis expanded the behavioral health force with a focus on recruitment, to recruit those people who look to use that trauma-informed care with our people going forward and our children, right? Absolutely. So first and foremost, whenever NACHW makes a statement, it's not just NACHW making that statement. They take pride in calling on public and private institutions to respect, protect, sustain, and partner with CHWs like myself. I am a proud member of NACHW. They take very much pride in basing their positions on what CHW members and who are not members share out. So our diverse community of CHW connect in unity by sharing of the field experiences. We face a lot of unsafe situations when we're going out there, right? How many unsafe situations have you all been in? I have some examples. When I get out, when I'm pulling up to a home, I gotta make sure I pull up and make sure there's no nails for when I'm gonna park my car. When I pull up to a location, if I'm doing a home visit, I have to be vigilant, right? And see who's around, check and make sure my surroundings before I even get out of my car. And then, when I get out of my car, I gotta shake my keys because that little chihuahua might be coming around somewhere to nip at my ankle. So we face some unsafe conditions in that way. So we are proud that NACHW's National CHW Policy Platform calls on the public and private institutions to respect community health workers. What does respect look like to you? Let's hear a few people call out. Respect. Reflective listening. Just listen to me what I have to say. What else? Don't interrupt me. I'm just trying to tell you something. Let me get it out, right? That, in a nutshell, will make me feel good. Wonderful. Protect community health workers. How would you feel protected? Absolutely. Yes, ma'am. That's a good question. Right? We're looking for some integrity. I can tell you. Right? Right?
There you go. Yes.
Yes.
I'm so glad to hear from you. How? How can we be protected? Simple integrity, simple transparency. 2 words, integrity and transparency. How does NACHW look to partner with community health workers? They partnered with us to create the council, and we'll talk more about those 5 geographical areas that we created those councils in to hear back from them. And most importantly, if we look ahead 10 to 15 years from now, how will community health worker platform be sustained? And I'm looking to hear from a few of you out here. How can we sustain our community health worker world? As the world evolves, so should we. So that's a big word that I see right now as a highlighter, say pivot, right? We have to pivot sometimes. Everything's not gonna come to us, serene, so we have to pivot, yes.
Now we're going to share a little bit about ASTRO's Adult Immunization Initiative. The Association of State and Territorial Health Officers, ASTRO, launched a new national program to reduce disparities in the vaccination rate and to advance health equity with the purpose of reducing the burden of vaccine-preventable diseases among adults. So first we had ASTRO. And then ASTRO, alongside of the National Community Action Partnership, that's NCAP, worked to engage a network of local community action teams in 5 geographical areas focusing on advancing equity in distribution, administration, and improving immunization rates among adult, racial, ethnical, minority groups, and rural population. So first you had ASTRO, and they are the health departments, the health officials. Then you added NCAP. Those are the agencies that have the energy assistance, the workforce development programs, all the family programs. But those two entities couldn't do it alone. So they had to come get the triple threat, the community health workers, because we were on the ground, we were working with the community, and we knew the community because they knew that we were worked just like the mailman. Through rain, snow, sleet, or hail, we're gonna get out there to help the community. And there ain't nothing stopping us. Nothing. No valley too high enough, no valley too low enough, no mountain too high enough, that we were going to get the job done. And that's how we became involved in the initiative.
So yes, partnership with NACHW and CHWs. A part of their process, ASLO established a partnership with the National Association of Community Health Workers to recruit and lead community health worker councils to give that recommendation, best practices for engaging community members in vaccination, and ask those focus in those 4 geographical areas. And we have organized together for more than about a year with a hyper focus on our experience within the community in these 5 areas. The conversation in the community was important to highlight, identifying the solutionary approaches. How do we approach the community once we had heard from them? What method would we use to approach them? We had to identify who the community felt was a trusted leader as well. Who was that trusted leader? The pastor, maybe the owner of a market on the corner could even be a trusted member, right? Or places they trusted to receive the education and or the vaccines. Remember I said that I was part in the contract with ICP at Loma Linda Hospital. So as part of community health worker, what we did was we connected with the prominent doctors at Loma Linda Hospital to really get that absolute information that we wanted to include in our webinar. And then we got creative with the webinar, right? To make it comfortable for people to want to come, participate in the webinar, but also feel free to share out, ask those questions. Well, what is in the vaccine? What are the ingredients in it? You know, do I have to get all 3 shots? Or, you know, just whatever question that they had that they could ask at that time.
Experiences and learnings from COVID-19. So I'm from the state of Wisconsin, and because of my experience, the organizations I worked with, the affiliation with my church, and I was a fresh set of eyes standing on the outside, they chose me to work with counties in Alabama and Georgia. Had no vested interest in those states, but I was the outside looking in, so I could give them a fresh opinion. So I had the pleasure of working with a CAP agency from Georgia, Enrichment Services Program, and we worked together on some initiatives that we utilized to improve the vaccination rate. One of the initiatives in the football season was called Flag on the Play. You got COVID running wild, and we want to keep going, especially with our sports, because everybody loves sports. Flag on the Play was COVID-19, and we used those opportunities to go to the football games, educate them about vaccination, and bring along COVID-19 vaccines along with us. During the basketball season, it was shots for shots. And for all you lovers for Valentine's Day, love is protecting yourself and others. And knowing the community, they also developed information that was translated into Braille. In 19 I'm sorry, in 2022, oops, I'm sorry, I skipped ahead. Go ahead. Your
Oh, you
experience.
can go back.
Your experience.
You want to finish?
Oh, go ahead.
Okay. So yes, can I see that? Yes, my experience was not at the time was it mandatory for me to get vaccinated. So it kept working, and then my daughter came to me. She said, "Mom, I've been waiting to pursue my education for too long. I gotta go. I'm accepted. I want to go to London and finish my grad school." I said, "Okay." Part of me to go, what I need to go to London is I have to get vaccinated. And I said, "Oh, it's gonna go on me first." And so that's what pushed me over the edge to get the vaccination, because of the Tuskegee Project, because of the Latino women who had their wombs removed and they didn't know it. Because of those historical things that happened to us, we were validated to be fearful, validated. And so we just needed to be educated on how it could be part of the solution in the world to go forward. So with that, oh, sorry, can you help me? How did I do that? Okay. So with that, part of El Sol, we use art to promote health. And so my director, Alex Fajardo, said, "Nisha, I want you to come and be a part of the meeting." And you know, he does that to me often. He said, "You know what? I know you can do it. I need you to come over here and do this." And I said, "Okay." So I was part of the meeting, and they were talking about what is the message in regards to a song that we can create, just to take the ugliness, the negativity out of what is going on. And I just began to think about some of those stories that I shared with you, some of those mothers, some of those fathers, and what they were going through. And I said, the song came to my spirit, said, "Where do we go from here? How do we begin to heal?" And they heard it, and I heard silence. And I said, oh, I opened my big mouth, and they said, "That's it! That's the song!" And so I want to play it for you today so you all can hear it. Oh, is it going to play? Oh. Does it play? Okay. Oh, I see. So you'll be able to see the song if you go to the El Sol website. We just employ you. Unfortunately, we cannot play it for you today, but please, please go to the El Sol website so that you can hear this song. This is the kind of song that you want to hear in a grocery store, this jingle, right? This is the kind of song that should have been playing when the world opened back up. Time to heal, time to move on, time to mend those relationships. Let's go, we can be strong, let's go. They also created one in Spanish too, so I'm so sure that you all will enjoy the song as I enjoy it as well. Okay, here's another one I wanted to show you all. May not be able to show you today, but I got to play Dr. Brown. As a young little girl, I always wanted to be a doctor. And so I was able to play Dr. Brown in a role play where Dr. Brown says, "You know what, our hospital is filling up with young, unvaccinated adults. And Captain Empath, can you please find out what's going on? I think some of them are down there, downtown somewhere hanging out, and they over there hanging out next to a senior complex, and they don't think they should be vaccinated, our seniors, and oh, and this." And so for me, I always used to tell my daughters, I wish I could beat COVID up in the park, dressed in all black, and just kick COVID's rump, right? That's how I really felt. So with being able to participate in this comic strip, as you can see, when you see the comic strip, we beat COVID and his imps and them viruses up, I tell you. And so we sent COVID running away. So please, please go to the website, elsolnec.org, so that you can laugh on your way home, enjoy this on the airplanes or on your car rides home. Really, really enjoy it going forward.
I had the opportunity in October to attend the vaccine equity meeting. It was held in Atlanta, Georgia. It was a meeting that the CAP agencies, ASTRO leaders, NACHW representatives, and CHWs came together to share learned experiences. I had the pleasure of meeting the lady on the far left with the pink shirt. she is from the CDC, and she was telling us about how COVID is going to be, the funding is going to be mixed with other vaccinations coming forward. They're just not going to be funding COVID. They were going to do it in other immunizations. It could be childhood immunization. It could be anything, but they weren't going to single out COVID. They were going to merge it together with other adult vaccination and childhood vaccinations. The lady on the far left in the pink jacket, she is literally a director of NCAP, the agencies that provide the social services events. So I've really learned and met a lot of wonderful people. We had a round robin where we had CAP agencies tell us what problems they had that occurred during the year. And there were 10 people, and they went around, and all 10 people gave them suggestions on what to do about it. And then 10 minutes later, we switched till we hit all 5 CAP agencies, and they walked away with a lot of resources from a lot of different people. At this conference and this whole project, we were the bridge that connected everything together, because we are the community health workers, the workforce you need for the world that we want. We are unstoppable. We are vital in every aspect of any problem, because we know the community and the community knows us.
Absolutely. So what's the biggest exercise for the heart? Does anybody know? The biggest and best exercise for the heart. Huh? Walking, that's a good one. Dancing, yes. Swimming, I love to swim. But what I'm talking about is the biggest exercise and the best exercises for the heart is to reach down and help somebody get up. Is that right? Mm-hmm. Yes, I believe so too.
That's for the soul. That's exercise for the soul.
Yes, you're right.
So now, you guys have heard, we did a lot of work. And so, resources. Now you need the resources from all the work that we did from this project. And now we would like to just share with you, resources from this project that you can use in your own COVID mitigation efforts. So, we have a live binder. And we also have a 2-pager that was developed. And it was developed for us to have feedback from the CHW Advocacy Committee. And this committee is going to highlight some of the main ways and resources that CHWs can implement to help and increase vaccination by telling their own stories and by addressing social determinants of health and focusing on the facts of how vaccine works. And that was a big part of our outreach efforts. Facts. We had to focus on the facts to get people to engage, with us. And so, again, this is great information for you to actually go out and make sure that you're able to use. And so, throughout this project, for the live binder, I think we have a QR code that may be a little card or like a business card or something that's placed on your table that you can
Can you hold it up if
scan.
you have access to it? We want to make sure everyone has that. Okay,
Great.
great.
So this is going to give you access to the live binder. And we're going to have resources. It's open to, anyone. And there are resources from many different partners and sources. And the binder includes resources on vaccines, boosters, prevention, treatment, long COVID, and of course, mental health and much more.
So you all were able to, how many of you were with the keynote speaker just now? Maybe almost all of you. So you guys, we launched the CHW anthem. It is amazing, right? It's so good. So I don't think they can play it, but the moves that go to the dance go something like this. We are fighting for health justice every single day. We are community health workers, born not made. So we just repeat those steps. We're born. We're not made. We come this way. As a 7-year-old little girl, my daddy would take me to 7-Eleven, and I walked by 7-Eleven and said, Daddy, oh, what's going on with him? Why is he asking for money? Oh, well, why is he over there? He don't have no shoes, Dad. My dad is a retired master sergeant, and my dad says, you have to stay away from them. You have to stay away from those type of people. And I said, well, why? I want to help the mayor, to help these people, Dad. I was 7. As I grew up as a young mom, I used to always tell my daughters, diffuse the fire, diffuse it, don't add to it. I say, wait, don't talk to your sister like that. You don't know what kind of day she had. You don't know, right? And so today, as an educator, I'm teaching emotional intelligence. And you can be the smartest person in the world, but if you don't have emotional intelligence, it's not gonna be, you're not gonna be an effective leader. Kind of like what the keynote speaker said. Cultural humility. Practicing cultural humility is key in working with our community because you need to hear from them to understand. I was working with a Hispanic lady and she had a cute little baby and she says, oh, well, if you tell my baby she's cute, you have to touch her foot. I said, okay, well, let me touch it. And then I saw another Latino lady and I said, oh, I remember because I'm so smart right now, you know, because I learned. And I said, oh, the baby's so cute. I went to touch her. She said, right? So not everyone has the same traditions as the other. And you can take on some subcultures as well. If you marry into someone that's from somewhere else, you take on subcultures. So in that way, everyone is different and deserves that trauma-informed care and that care coordination that we as trusted members of the community can provide. We have the key.
Now it's time for your turn. Question.
Questions, comments, concerns?
You know, guys don't seem like you're shy at all, so speak up.
Life experiences, something you want to let out today. We want you to go back healed. We want you to go back feeling that you were heard. You have a platform. Any ideas that you have to generate in regards to today's discussion? Go ahead, dear.
I'll just share a little story because yours kind of reminded me. My name is Jessica. I live here in Texas. We're all part of the Texas Department of State Health Services and Region 910, huge, expansive, rural. I live in a very small town, and so before COVID, I wasn't working for the state of Texas yet. During COVID, I think probably the beginning maybe is in April is when I started work. So I had maybe 3 or 4 months of not being a part of that. So I was on the outside, and I didn't really know a lot of the in part that I do now. But the community I live in, what you did, we were doing without being CHWs.
Okay.
Nobody knows what a CHW is. Didn't know, had no idea. But that's how we work. And that's kind of how I think CHWs are. We're our own little, small little community of people. And so not only are we helping each other, but we're trying to help everyone else out there and bring them into the community in some way. I mean, we're family, and that's how we see each other in the community. Even in my church, we're one body.
Yeah.
You know, we all play a part. So yeah, it was really neat to see these people on Facebook. Hey, who's running up to San Angelo? Who's running up there today? Can you run by Sam's? Meet me over here. I have money to give you. And so they would go up and buy bulks of things to bring back down and then take it to the food pantry, our resource center, and get those things to people. Whatever it was, we tried. If we already had it, we would give it.
Yes.
Paper plates, napkins, you know, plastic forks, and that's the stuff we were trying to get out so people didn't have to worry about always sanitizing everything. So your story just reminded me of that, and I was like, oh man, I was a CHW before I was a CHW. So
That's
very
right.
cool.
You're
Born, not
born,
made.
not made.
Hello.
Hello. I'm not going to sing.
Okay.
Do you guys have suggestions or examples of how you've used the toolkit, and like what are some best practices for how we should use the toolkit moving forward?
I used the toolkit was used like when people call for resources. You can access the toolkit. We were given the toolkit. We were actually teaching them how to use the toolkit in the community and giving them access to it. So if they couldn't reach someone to find out where's some food, where housing, where shelter, that they had the toolkit that could not only give them the vaccination rates for their area, it not only gave them where they can locate a doctor, where they can find testing sites, but everything they needed instead of looking for a person that they might not been able to reach. That was the whole purpose of designing it.
And so it's ever evolving and ever building currently. There might be a new resource on there tomorrow. Any other questions?
Right here.
So I did hear about the immunization shots so what my organization is doing before school starts is having a resource. So in Madison, Wisconsin, we are familiar about the immunization shots, and what my organization is doing is having a resource fair, and I have collaborated with Fitchburg Pharmacy, so we'll be giving book bags out, a resource fair, and taking information for the kids or any adults need immunization shots. So what I do is put it on our website, put it on the neighborhood association sites. So I'll gather the information to give to the pharmacists so they can go into the people's information, get approval, and have the medication there to get a shot.
That's awesome. You're dripping up some sauce for that.
My whole job is COVID, so that's the only thing I could talk about. And right now, nobody wants to talk about COVID, so I had to get creative. I had beauty pageants where I had misinformation, not MIS, but misinformation pageant, where I had 5 myths and a fact, and I picked random people in the audience as they came in, see if they wanted to participate, let them pick their card. I said, whatever you pick on your card, you got to sell it like you're going to get $1 million for it. And we had a beauty pageant, and I actually crowned the winner. It could have been a guy or girl. I have a crown and a scepter for a guy, and a tiara and flowers for the girl. And we talked about how easy it is to sway a person because no one picked the right information. They went with the popular person in the room, which was telling them a lie. So it's easy for you to get the wrong information out, but doing things that are interested to them. Right now I'm doing COVID and everything, COVID and nutrition, COVID and diabetes, COVID and high blood pressure, whatever month it is, if it's Cancer Month, COVID and cancer, how COVID affects cancer. You got to know your community. You got to know what they're interested in, and you adapt whatever lesson that you're teaching. You adapt it to what their interest is. I'm good with doing board games. I love Price is Right. I always redo the Price is Right game. The one with the $7 and they have to do the number. I do $7 and I ask you a question. I give you a paddle, two, or frost. And I give you $7, and if you got $1 left, you can go pick from the goodie prize on the other side. But I say, okay, and wherever I am, I always make the center of the money that I'm giving out something unique to that area. Like I did it at church, I put the pastor's face in it. I did it at a community center, I put the community center face in it. I did it with citizenship, and I put they had to go when they went for citizenship. I put some symbol for citizenship in there. But I asked them questions. I was animated. I was like, okay, give me my $1. Mama need a new pair of shoes. And everybody got into it. But they learned and retained the information. And that's all it is, giving them the information, talking to them as community health workers, talking to them, finding out what their barriers are. Because there's no need of me going in and talking about immunizations or ask misinformation or talking about Tuskegee if the barrier is transportation. The barrier is that they don't have access. What I'm talking about, they don't care about. So I have to meet them where they are and know what they need. Food, okay. I'm gonna put I'm gonna call Feeding America. I'm gonna call Hunger Task Force to give free food. I'm gonna have a food event if that's what's important to you. But you're gonna talk to me about. I want to talk to you about vaccination. So showing interest in what they value to give the message that I want to give. I travel with a big spinning wheel. I always got prizes. When I do my presentations, I do a pre-survey. They do the presentation, they come out, spin the wheel while they do their survey, and then they pick a prize. And everybody likes to get prizes.
Yes.
Most of the time what I do when I do misinformation is after I give them the misinformation and the credible sites, I give them all candles, little fancy candles, and then I deputize them. You didn't think you're going to get my candles for nothing. You are now vaccine ambassadors. You know where to get credible information. You know what information is right. Now it's your responsibility to dismiss the myths that are out there. I need your help. This is all of us working together.
That's amazing.
Yeah, that's awesome.
Absolutely. So we use pedagogy, which is the study of teaching, and we also use popular education, Paulo Freire, popular education, where we use a common ground, something in common to bring the people together, to get them to create that dialogue, to share out, so that we have something tangible to present to the ones that have the power to make those changes, implement those changes as well. So that concludes our session for today.
Thank you all.
Thank you.
Thank you so much.